This video will explore repair as a conservative alternative to replacement of a restoration. You should have already read this in one of the assigned articles. Replacement of defective restorations did not have a significant effect on the longevity of restorations when compared with alternative treatments and with the absence of treatment. So again, from the previous video, replacing a restoration is actually not better than repairing or doing something even more conservative. Studies have shown that replacement restorations do not perform better than any of the other treatment approaches. So if you have a restoration that has an open margin, or even if you have caries at the margin, the option on the right, the repair, may be the best option for longevity. Small, simple restorations generally have better longevity than large, complex restorations. So on the left, you're placing a large, complex, four-surface restoration involving a cusp, which is not an easy restoration. On the right, you're placing a small, one-surface restoration. According to the literature, the simple, one-surface restoration is going to last longer. Another important point is that you're leaving the original restoration alone, and it will last longer. So by repairing this amalgam, you are extending its longevity. You have already read this. In our study, the restorations that were repaired had the highest survival estimates, even in comparison with the restorations that were replaced. That's because we're placing smaller, more predictable restorations when we repair. So here is a definition of restoration repair. Repair involves removing the affected portion of the restoration to correct a defect or contour, or to access a caries lesion adjacent to a restoration. Repairs perform as well as replacements, and they are much more conservative and kinder to the pulp. Why is it that repairs are more conservative and kinder to the pulp? Well, again, when you replace a restoration, you remove tooth structure along with the restoration. Again, the black line represents the new tooth structure that you have just removed. So first, you are exposing dentinal tubules and you're cutting odontoblasts. That will cause post-op sensitivity. And second, the preparation is getting deeper and closer to the pulp. That's why a repair is more conservative and kinder to the pulp. Some studies, like the one I had you read, show good longevity of repaired restorations, which, again, increases the longevity of the original restoration. So you are allowing the patient to keep the restoration in their mouth longer. Oh, and that's what these researchers found. Repairing a restoration increases its longevity and is less expensive and more conservative. So if you note a small defect or detect a small caries lesion, you should consider repairing the restoration. But I want to stop and make sure you understand that I'm assuming that the rest of the restoration is clinically acceptable. That means the anatomy is good, the contours are good, the proximal contact is good, the rest of the margins are good, and the restoration is not trapping food or plaque. So if you have an otherwise serviceable restoration, it makes sense to repair.